Rare monkeypox outbreak in UK, Europe, and US. What is it and should we worry? There's a monkeypox outbreak in the United Kingdom, Portugal, Spain, and other European countries. The outbreak is small, so far about 80 suspected cases, including 9 in England, 17 in Canada, and 23 in Spain. There are also cases in Portugal, Sweden, Italy, and France. 2 suspected cases have also been reported in the US. But health officials have little clue where people caught the monkeypox virus. And there's concern the virus may be spreading through the community, undetected, and possibly through a new route of transmission. This outbreak is rare and unusual, epidemiologist Susan Hopkins, who's the chief medical advisor of the UK Health Security Agency, UKHSA, said in a statement on Monday. Exactly where and how they, the people, acquired their infections remains under urgent investigation, the agency said in the statement. Monkeypox can be a nasty illness. It causes fever, body aches, enlarged lymph nodes, and eventually pox, or painful, fluid-filled blisters on the face, hands, and feet. One version of monkeypox is quite deadly and kills up to 10% of people infected. The version currently in England is milder. Its fatality rate is less than 1%. A case generally resolves in 2 to 4 weeks. Typically, people catch monkeypox from animals in West Africa or Central Africa and import the virus to other countries. Person-to-person transmission isn't common, as it requires close contact with bodily fluids, such as saliva from coughing or pus from the lesions. So the risk to the general population is low, the UK Health Agency notes. But in England, 7 of the 8 cases don't involve recent travel to Africa, suggesting the patients involved in those cases caught the virus in England. On top of that, those individuals haven't had contact with the one patient known to have traveled to Nigeria, the UKHSA reported Tuesday. Together, this data suggests the virus is spreading in the community undetected. Presumably this is cryptic spread from an imported cases, virologist Angie Rasmussen of the Vaccine and Infectious Disease Organization tweeted on Monday. In the US, the patient in Massachusetts had not recently traveled to countries where the disease occurs, but had visited Canada. In addition, there's evidence the virus could be spreading through a new route, sexual contact. What is even more bizarre is finding cases that appear to have acquired the infection via sexual contact, epidemiologist Matteo Prochaska at the UKHSA tweeted. This is a novel route of transmission that will have implications for outbreak response and control. We are particularly urging men who are gay and bisexual to be aware of any unusual rashes or lesions and to contact a sexual health service without delay, epidemiologist Hopkins said in the UKHSA's statement. Scientists at the US Centers for Disease Control and Prevention are watching the outbreak in Europe closely. We do have a level of concern that this is very different than what we typically think of from monkeypox, Jennifer McQuiston, a senior CDC official, told health news site Stat on Tuesday. In 2019, the US Food and Drug Administration approved the first vaccine for monkeypox, which also protects against smallpox.